Good morning, ladies and gentlemen, and I welcome you to our very first virtual media conference. It's been nearly 7 months since we started living in this new reality, a reality that none of us had prepared for. Its severity is witnessed all around us, with bearings on the world economy, small and large business enterprises, and livelihood across all segments of society. As we kept grappling with these changes, the world came to a standstill due to the lockdown. Over time, the country and businesses are learning to adapt to this situation and are gradually opening up. The unique challenges unleashed by this pandemic pushed us to quickly adapt to the new normal and transform the way we work, learn, and live. The health crisis has created an opportunity to build a digital-first environment. We stand at the forefront of a technological revolution, an opportunity to completely transform the healthcare sector. The health sector is disaggregated today, with service providers, whether practitioners, diagnostic centers, pharmacies, loan companies, and insurance companies, all working independently. India is also known as the world's diabetic capital, and we know cardiovascular diseases are also on the rise. Yet, there are no preventive or personalized healthcare solutions for you. Is that in India, almost 65% of healthcare expenditure comes from the household pocket, which obviously burdens the financial health of payers. However, every crisis or challenge presents an opportunity to push the boundaries of what is to what can be. We have always tried to explore, understand, and deliver solutions to serve the unmet needs of our consumers. And over the years, we have gained a deep understanding of consumers and their financial needs and delivered this in an increasingly phygital world. With a consumer-first digital approach and a culture focused on excellence through innovative disruption, Bajaj Finserv as a group helps solve customer problems by empowering them with higher purchasing power, instant loans, and the opportunity of a better life. Our strong focus on technology, our extensive channel partner network, and unrivaled large customer pool helped us disrupt the consumer finance business over the past decade. Health is at the center stage today, and to manage the prevalent health challenges, it is important that the various interconnected yet disassociated services are integrated on a single platform in order to provide comprehensive, personalized, and preventive healthcare solutions to all of you, anytime, anywhere. There hasn't been a more opportune time to reimagine and reorganize the healthcare ecosystem with an India-centric solution. The Health ID initiative undertaken by our government under the National Digital Health Mission is bound to have a far-reaching impact on the future healthcare delivery infrastructure. Under this, every Indian citizen will have a unique health ID, digitized health records with identifiers for doctors and health facilities, making it more technologically advanced, personalized, and timely. Without further ado, I am pleased to announce the launch of Bajaj Finserv Health. Our new health tech solutions business, aimed at improving the health outcomes of consumers by changing the paradigm from reactive to proactive. The whole concept is built around a holistic and integrated healthcare solution, Arogya Care, an industry-first, one-of-its-kind, personalized, preventive, and prepaid healthcare solution for Indians by Indians. Through a mobile-first approach, We are bringing the whole healthcare ecosystem to the consumer's fingertips, leveraging technology, our large customer base, and a strong partner ecosystem. Bajaj Finserv Health will enable connected, cost-effective, and convenient healthcare solutions for consumers to enjoy in a seamless, personalized, and convenient experience from the comfort of their homes. With this, I would like to invite Devang Modi, CEO of Bajaj Finserv Health, up on stage to walk you through Arogya Care and explain how it will redefine this new age healthcare business.
Thank you, Sanjeev. It's indeed an exciting moment for all of us at Bajaj Finserv Health to finally introduce Arogya Care to Indians. The pandemic made us all realize that healthcare today needs differentiated solution to live up to customers' expectation.
Absolutely, Devang. And before we move ahead, let us seal this momentous occasion with the presence of a very special guest joining us from Delhi to share his thoughts on the healthcare ecosystem, the government's initiatives, and our new venture. With great pleasure, we welcome Shri Amitabh Kant, CEO of Niti Aayog, to share a few words. Over to you, Amitabh ji.
Thank you, Sanjeev and Devang, for having me here. And I would like to congratulate you on this very exciting new venture of yours, especially when healthcare stands at the cusp of a major digital transformation. India's health sector needs more and more big and large Indian companies to infuse it with the right resources and support. The COVID-19 pandemic has presented a unique opportunity to transform our healthcare system, and with the Bajaj Finserv entering the space, it will set a unique example and encourage many more and more private sector players to come forward and partner with the health sector to help realize the vision of building a healthy and a very progressive India. The true pillars of a digital health is all about what we are envisaging in the National Digital Health Mission, a unique health ID for each citizen on the lines of the UPI ID, what is known as the Aadhaar, a health card for call with data embedded and linked, Digi Doctors, a database of doctors with e-signatures, personal health records, and healthcare facility registry, a database of hospitals, clinics, and labs. And these are the broad pillars of what the Prime Minister launched on August 15th, the National Digital Health Mission. Actually, the National Health Policy envisions to have digital health technology ecosystem, and it recognizes the integral role of technology, that is e-health, mental health, cloud, Internet of Things, wearables in the healthcare delivery. So the National Digital Health Authority, which has been set up, is here to regulate, develop and deploy digital health across the continuum of care. The policy advocates the extensive deployment of digital tools for improving the efficiency and outcome of the healthcare system. This policy also aims at an integrated health transformation system that actually serves the need of all stakeholders and improves efficiency, transparency, and citizen experience. It aims at delivery of better health outcomes in terms of access, quality, affordability, lowering of disease burden, and efficient monitoring of health entitlements to citizens. That is the goal. And this is not possible without the private sector playing a key and a critical role. We've been making efforts towards having a national digital health platform with the concept of a national health stack, which eventually evolved into a national digital health blueprint, And we are now launching the health mission, which the Prime Minister had announced on the 15th August. Parallel efforts are also going on in the form of integrated health information platform, whose primary objective is towards the introduction of EHR into the medical system, with a focus on the continuum of care, and PMJY 2.0 IT platform, which aims at the integration of insurances and other provider level platforms. Eventually, both of these will be integrated to complete the loop. The National Digital Health Mission is a technological leapfrogging in ensuring equitable health care service delivery in India. The launch of the National Digital Health Mission has ushered India into a completely new era of technology-enabled healthcare delivery. The health ID that will be created for each individual will provide access to integrated services across different tiers of health delivery. This is extremely critical to my mind to help realize universal healthcare. The current focus is on health ID, health facility registry, personal health records, telemedicine, digi-doctors, and e-pharmacy. We have taken this ambitious initiative of rolling out with pilots starting in several parts of the country, and the aim is to have a single database of health information that is also portable among the different healthcare service providers across the country. Such a huge volume of real-time clinical data can prove extremely useful when managing pandemics or undertaking biomedical research. For ordinary Indians, it can also ensure better health outcomes because the data collected will help doctors match patient needs. Our pilots have already started in government hospitals in Ladakh, Chandigarh, Puducherry, the Andaman, Lakshadweep, Dadar and Nagar Haveli, where doctors are working on enrolling both patients and doctors. Public health experts say that these pilots will help to uncover many teething issues as we go along. The central agency responsible for the design and implementation of the NDHM is the National Health Authority, which is also handling the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. Will this lead to a digital divide? The answer is no, because the NHDM does not require everyone to have a mobile device in their hands. The crucial requirement was public access to digital records. And experts feel that the government has clearly defined the objectives in order to get off to a great start. And now the private sector needs to align itself with the government, and without which this mission will never succeed. I've been a long-term believer that such an ambitious mission will be successful when private hospitals and insurance companies become an integral part of the mission and adopt digital platforms in healthcare delivery and healthcare finance. Given the high out-of-pocket expenditure, EMI financing and health insurance plans can facilitate health services to be accessible to all. The Bajaj Finserv approach to adopt NDHM and integrate its financial plans with National Health ID is extremely commendable. Bajaj is a pioneer in bringing a holistic health ecosystem to the customers, where doctors, hospitals and diagnostics will be on board to provide health plans for OPD, diagnostic tests and health checkups, along with provisions for health insurance. It is imperative to change the behavior from a curative approach to a preventive approach to healthcare delivery. And in all this, all of you will play a very critical role of a facilitator and a catalyst. Once again, ladies and gentlemen, I congratulate all of you on the launch of Bajaj Finserv Health and with your rich experience of driving tech-led innovations in consumer finance space, I'm certain that Arogya Care too will chart newer innovations and health tech breakthroughs in the times ahead. I wish you all the best, and do take care in these very challenging times. Thank you very much, ladies and gentlemen.
Thank you, sir, for your kind and encouraging words and sharing with us the different government initiatives underway. With Arogya Care as our guided concept, we hope to make the healthcare ecosystem affordable, accessible, and personalized for consumers. Aligned to the broader vision of the government in embracing the next wave of healthcare transformation in India. Now let me tell you about few things which drove us to launch Arogya Care. India ranks 145th in Global Health Index amongst 195 countries in terms of quality and accessibility of healthcare. Far behind China, even Bangladesh, Sri Lanka, and Bhutan. The results highlight the urgent need to contain the widening gap between the quality and accessibility of healthcare based on 32 causes of death which should be preventable with effective medical care. According to National Health Profile 2019, over 50% of all deaths due to communicable diseases in 2018 were because of respiratory diseases and pneumonia symptoms, common with those which we are experiencing in COVID-19. India spends only 7% of its total healthcare expenditure on preventive healthcare. Balance as high as 80% gets spent on treatments and medical intervention. This is truly avoidable. India's out-of-pocket expenditure in healthcare is as high as 65%, which compares to 36% in China and 37% in Indonesia. Out-of-pocket expense is an important metric because imagine, patients are already going through emotional trauma of illness and treatment, and we at Bajaj Finserv Health are trying to solve this by integrating the fragmented service delivery of the healthcare ecosystem, enabling consumers to become prudent buyers of health plans under Arogya Care, making healthcare accessible by extending its reach and availability, enabling easy healthcare financing through prepaid plans, empowering consumers to choose their health providers. We have lots of strength as a group to get going and make this possible for India. We have unmatched capability to manage the expansive distribution of providers. As a group, we have in our group companies a fantastic distribution management capabilities. Bajaj Finance today operates at 100,000 plus stores. Bajaj Allianz General has 7,000 cashless hospital network, and they have a humongous auto service center network. To deliver tech-enabled and consumer-centric solution for bridging the need gap challenges of the healthcare ecosystem, we will streamline processes, enable greater connect between provider and patients, support healthcare needs with easy financing and insurance options, while maintaining highest level of data privacy and security. Let me now introduce our consumer product Arogya Care. Arogya means good health and wellness, and that's what we are striving for. Arogya Care is an industry first, one of its kind, personalized, preventive, and prepaid healthcare solution. Let me give you an illustration. Today, Arogya Care plans include doctor consultation as well as regular diagnostic checkup, which is essential to ensure that disease is detected as well as managed in time. We had to shift away from traditional one-size-fits-all approach to become more personalized and tailor experience to align to our customer need. For example, we have in India lots of consumers suffering from lifestyle ailments such as diabetic. One of our Arogya Care plan is meant for diabetic customers, which means it will have essential required periodic blood sugar test as well as consultation with leading diabetologists in India. When consumers buy these prepaid plans, their adherence to treatment will increase, thereby reducing the risk of over or under treatment. With changing times, consumer needs evolve. They demand the right avenues of channelizing their needs from savings, financial protection, lifestyle spending, to accessing better and comprehensive healthcare services at the touch of the button. This has been unusual and uncertain time for all of us. And we couldn't have done it without our partner network, who are equally committed towards creating healthcare transformation for our consumers. Since our start, now we have 112 hospital partners. These partners operate over 200 hospitals pan-India. We are also delighted to have already enrolled 3 lab partner chains, which have 671 consumer touchpoints. We have also listed over 9,000 doctors already on our provider network. This network is growing fast as we expand in geography as well as our consumer reach. All our Arogya Care plans are accessible on our mobile application, which will be gateway for consumers to access our provider network, interact with their chosen provider, manage health records and buy services personalized for them. I proudly present to you our Bajaj Finserv mobile app, your gateway to all-inclusive, seamless healthcare experience right at your fingertips. Today, you can search for appropriate doctors from list of 9,000 doctors we have using discipline, symptoms, and type of consultation. You can also book appointments with most of them right on the platforms. You can conduct a teleconsultation, which is the need of an hour, with many of them, and also get your prescription right on the app. Also, book the diagnostic test, including COVID test, at our lab partner network. Consumers can also conduct health risk assessment, which will help us personalize Arogya Care meant for that consumers. Consumers can buy as well as consume Arogya Care right from our app. Powered by the latest innovations and digital health technology, the Bajaj Finserv Health mobile app is available for download now on Android Play Store and iOS App Store.